Okay, again, we carry on with our talking. This fantastic talks in NPR. Different topics. We know today talking. Today is the time for Dr. Sayed. You know very well Dr. Sayed. Dr. Sayed is part of our school. You know very well. I don't need to present yourself, and in the podcast is not necessary. They know you very well. I think they know me very well because they look in every day. Yes. Okay. And we carry on in this new podcast. And listen, this podcast, one part of my life is dentistry.
Yes.
And then I want to talk about not just dentistry, but the people we said, what want to say Dr. Sayed for dentistry? No, because that is an interrogation. No. What is saying a physiotherapist talking with dentists? Well, that is important, the thing we were talking today. Okay? Because I will talk about vibration therapy in dentistry. You know why? Because I was listening Saturday was, I think, a podcast, a webinar you did. It's
Yes.
some fantastic tools that I, as a dentist, because you are using that for physiotherapy, but when we do oral rehabilitation, I said my students, we are doing physiotherapy of the craniofacial system. I do. I am a specialist in craniofacial orthopedics as one of my specialization. And in my specialization, we do re-education. I was fascinated about the thing you're talking in this webinar. And I want you now to bring you to talk about this in our channel, okay?
Yes.
Tell us about these fantastic tools, because I want to introduce these tools in dentistry. That's very nice. For we call the oral corridor re-education. That is physiotherapy. We do exercises, but these tools are fantastic. Tell the name of the tools and talk about these tools. Okay, it's for you the word now. Okay.
Yeah, thanks a lot, Dr. Biroko, for the compliment. And I was really very happy to see you to attend my webinar through London Academy of Sports and Health Science UK. Before I will talk about the tools, as you perfectly said, that there has to be the coordination between the muscles. Because we will not go beyond the face, we will not go to any part of the body, except we will talk about the oral capacity, the oral muscles, the lips, tongue, cheeks, what we say the orbicularis oris, and then buccinators. We will talk about mandible, we will talk about the tongue muscles and all. And mostly, these conditions are associated with when there is non-alignment in the jaw, which you correct by, we have a lot of dentistry tools by which you correct the non-alignment of the jaw and all. And mostly it is because of the improper balance of the musculature. Somewhere the muscles are very spastic and somewhere they are very flaccid. And somewhere they are tight, somewhere there is loose. And so there is no alignment. So brain-body needs coordination. Brain-body coordination is very important. And awareness. For example, if I'm looking at you like this and somebody is knocking at my ear, I will definitely look at who is just knocking me, isn't it? Or somebody is just pinching my ear, I will just definitely look at, because this is attention. My brain is telling somebody is doing something to your ear, and then my attention goes to over there. So we need some things, some tools to rehabilitate, to strengthen two things: the muscle and the nervous system, the sensory nerve endings, sensation and all. So there is an introduction. in our previous times, for the patients with dysphagia, we used to use the long cotton buds dipped in water and then stimulating the tongue, stimulating and trying to swallowing reflexes, improving the swallowing reflexes. Mostly the occupational therapists help in that, in this regard. But now the latest tools, the R company in the US has started with Z wipes. These are pen styled, like a pen attached with the tips, and tips vary. Tips vary from plain to horizontal to the dotted ones, and they are very skin friendly, and they are not very harmful because this oral aperture is very sensitive, so they have manufactured in that way. So why vibration therapy in the mouth? First of all, there is, when you touch the vibration tool to the lips, there is more alertness. If you touch a vibration platform and vibration board or anything, you will feel more alert. And there is a body awareness, where all the vibration is touching, there is a body awareness, and there is greater intensity of input. Like when you put vibration to a part of your body, there's a greater output of greater input of the stimulation, and this stimulation reaches through the sensory nerve endings to the brain. And plus, it is also having super calming effect. Where, as I told you, that we are all vibrational beings. When we are in touch with any part of the vibration thing, it's a super calming, because it is contracting and relaxing the muscle, and each and every fiber is contracting and relaxing, and there's an improvised circulation to that part of the body, and that means there is calmness. And we usually start with the lips, and usually what you do when you want to train the tongue, you have to keep it at the one angle of the lip, the vibration tip, and tell the client to touch it with we call it lateralization of the lips, like here, then top, then down. Even we can attach a lollipop to it, licking as a playway method, not to make it as a school, like he is coming to teach you and all. Like, make a playway method, like you gain the confidence of the client like that by doing these things. And it is also having the part of see, in Europe there is a very good culture that whenever they wake up in the morning, they will take first a black coffee to get arousal, to get ready for the work.
In Italy. No, in Europe, in Italy we have it.
So when you are taking a coffee cup, you will be getting arousal that you have to go for the work. Likewise, when a client comes to your clinic, you are doing these vibration, it brings an arousal. He's ready to perform the movements.
Yes.
And also, it is overcoming the old traditional ways and all. And there are some other devices to. I will show you one of the devices I received today. It is, if you can see it.
Yeah. Yes.
This is very nice for your vaccinators. You have to hold it. I will demonstrate for you.
Yes.
But don't fatigue your muscles. This is very hard. This is providing the resistance, and when you are putting it in your mouth.
Yeah. And this one is also very good to relaxing and to work for pterygoides, external pterygoides.
Yes, pterygoides muscle, so that it becomes very strong and the jaw becomes very strong. And one more thing, for the dentistry, to improvise the jaw and to strengthen the jaw, we put the Z wipes in between the teeth and ask the client to bite it. When it bites, the vibration is stimulating it, and there is a feel of more biting efforts done by the
And
client.
do you know something?
Yes,
Eh?
doctor.
We put in the brain of the people the curiosity. Yes.
Yes.
Next time you will show the tools in our channel. What do you think about that? Okay.
Yes.
You will do a demonstration. The people know that the tools are. eh? Next time we will do a podcast and live. Yes, and you will show these tools. You know why? Because with the better device, you know very well the better device emulates the craniofacial system. This is something. It's not vibration therapy, but it's proprioception. You know, proprioception is
Exactly.
vibration therapy. Yes, all right. And these tools are complementary for dentists. What do you think if we organize a podcast to show the tools and the people will stay there waiting for this podcast? What do you think? You ready
Yeah,
for the next time?
surely.
Yeah.
Our next episode will be for demonstrating it maybe in the last week of this month, because
Yes.
I will be receiving tools. And this one was very handy for me to show you. This is my personal, because I'm also getting strengthened
Yes.
my jawlines.
Yes, that is interesting because we will do a little demonstration. Because if they want to learn more, I think you will do a course for us to use it. But yet we do something to demonstrate the tool. What do you think? You ready for the next time? Yes, all right.
Yes,
We
we are ready.
organize.
And also we want to inform our viewers and who are just subscribing to our channel and all, that this especially for the dentists who are going for this masters in osteopathy, we are going to we have included this in our vibration therapy lectures, which will be as a master class, and we will be teaching them in practical sessions as well.
But you know, I am thinking. You know, I have a master in craniofacial, myofunctional, and postural orthopedics. That means growth. We will introduce that in the master. That is very nice tools. I will invite you to do a presentation in the master of craniofacial dentistry, craniofacial orthopedics in dentistry, because that are an interesting tools to introduce in MPR science. That's very, very nice tools. All right. We have a different tool. We have posturometer, we have TED, we have different tools. But that's very important tools for dentistry. Yeah? It's good for physiotherapists, but I, as a dentist, I understood that is a very good tool for dentists. All right. We don't do more information. Be ready for the next podcast. That was it's suspense, you know.
Yes.
And always, if you like our talk, do a like. Remember, subscribe, and if you click in the bell, you will receive the information of the new podcasts and videos we do in the channel. Okay, thank you so much, Sayed, for your time. I know you're very busy, but it's very good to make information for the people. Our channel is information, yes, okay. No formation, it's information for the people. We show different things, okay. You want to say something before close the podcast? Yeah.
Thanks a lot, Doctor. It was my pleasure to be on the MPR Science Broadcasting channel, and I'm really counting the days to start up with this master's program, and to be and I will definitely recommend everybody, those professionals who want to know something more, what is latest happening, to join us for the masters. That will be great.
Okay, if God wants, the master will start the end of January the next year. I think we have to be ready for that time. Okay, we start to promotion the master in short time. Okay, thank you so much, Sayed, and see you in the next podcast. Don't forget, we are the MPR International Channel. Bye bye, everybody. See you next.
Bye bye.